Yad Randella Bluehouse yinshia, Titna Janinsle, Kintlachini Bashichin, Trabaha Dashiche, Honagati Dashinella, what I Sunshle. I am a member of the Navajo Nation. I grew up in Ganado, Arizona, a small reservation community. Both my parents were civil servants of the Navajo people. My late father, Homer Bluehouse, was a ranger, police officer, and eventually became a district court judge, who was later appointed to the Navajo Nation Supreme Court. My mother, Alta Bluehouse, created Aniwanika Life Care Incorporated, a nonprofit agency that provides assisted living services to elders and individuals with disabilities. She named it after a longtime health advocate who was also one of the earliest women leaders to serve on the Navajo Nation Tribal Council. Prior to this, Mom helped start 2 nursing homes on the Navajo Nation in the mid-1970s. My mother is 75 years old and has not retired yet. I too recently hit a major milestone birthday. We both struggle with this period of change we are approaching. What comes after retirement? Where will my mother decide to live? What are the experiences she might face? Loneliness, uncertainty, financial instability, conditions, unfortunately, other elders are facing across the United States. Primarily, it was Mom who encouraged me to pursue a higher education. After college, I was committed to serving and advocating for Native children and youth in Arizona. My compassion for helping others opened many doors. In 2001, I joined the Intertribal Council of Arizona, the Area Agency on Aging. I monitored tribally operated elder programs in Arizona, coordinated the Caregiver Support Program, organized the annual Aging Conference, and created the first Elder Abuse Task Force for Arizona tribes. 5 years later, I became the Auction Indian Community Senior Center Director near Phoenix, Arizona. I coordinated daily services for nutrition, transportation, shopping, and home visits. It helped me to better understand the everyday needs of Native elders. On November 3, 2008, I began working as the acting director of the National Indian Council on Aging Incorporated in Albuquerque, New Mexico. 6 months later, I was confirmed as the executive director. Nakoa's mission to advocate for improved comprehensive health, social services, and economic well-being of American Indian and Alaska Native elders. It was founded in 1976 by members of the National Tribal Chairmen's Association. Many of our early founders and strongest advocates are reaching their later years or have passed on. We have many Native people and organizations who are advocating for our sacred homelands, our water rights, and for our Native children. But who are raising their voices for Native elders today? We need a new generation of leaders and advocates who understand what lies on the horizon. There is a growing population of aging Native baby boomers who will likely need specialized elder health care, long-term care, and other support services. State and national aging networks will also need to become culturally competent and provide ethnically diverse services for an increasing number of elders both on and off Indian lands. Nakoa has provided almost 4 decades of leadership and advocacy for Native elders. How did we do it? First, Nakoa coordinates biennial conferences on aging in order to provide a platform for Native elders to voice their challenges and successes to tribal, state, and national leaders and policymakers, as well as aging network providers. Resolutions are approved by the Nakoa Council and then submitted to the National Congress of American Indians for submission to federal agencies, Congress, and the President of the United States. Under my leadership, Nakoa has successfully coordinated 3 biennial conferences on aging. Second, we partner with the Diverse Elders Coalition to educate policymakers and the Aging Network about the need for equitable aging services. Third, Nakoa educates and informs tribal community members, leaders, and programs about important federal policies and how they impact Native elders. For example, the Social Security Act, the Older Americans Act, and the Affordable Care Act. The Social Security Act was created in 1935 and provides an economic lifeline for millions of people, including American Indians and Alaska Native elders, and those with disabilities and children. In 1965, 2 amendments were passed, Medicaid and Medicare, which covers medical expenses for elders, disabled, and low-income Americans. In 1965, Congress passed the Older Americans Act, which created community social services for older persons. In 1978, the Older Americans Act was amended. A new section called Title VI was added, which provided grants for Indian tribal organizations. Title VI was a momentous opportunity because it allowed for aging services to reach Indian elders. Nakoa and other influential advocates made it happen. The Older Americans Act authorized the Senior Community Service Employment Program, CSEP. It is a federal program that helps low-income job seekers who are 55 and older by providing them with subsidized community service, employment, and training opportunities. Finally, the Older Americans Act provides funding for the White House Conference on Aging, which occurs every 10 years. Because the Older Americans Act has not been reauthorized to date, the 2015 White House Conference on Aging was conducted in 5 community forums via internet. Most of them occurred in non-Indian areas with few Native attendees. When I caught wind of this, Nakoa secured a listening session in Norman, Oklahoma on May 6, 2015. Over 100 American Indian and Alaska Native elders met with Kathy Greenlee, Assistant Secretary for Aging, and Cynthia LeCount, Director of the Office of American Indians, Alaska Native, and Native Hawaiian Programs. The event was officially sanctioned by the 2015 White House Conference on Aging Director Nora Super to ensure that Indian aging was represented. The Affordable Care Act was signed into law in 2010. It was created to expand access to health care coverage, to control health care costs, and to improve health care quality and coordination. Most importantly, the Affordable Care Act includes permanent reauthorization of the Indian Health Care Improvement Act, which extends current law and authorizes new programs and services within the Indian Health Service. The law also expands long-term care and support services for American Indian and Alaska Native elders. Unfortunately, long-term care and support services is an unfunded mandate, which means that it is a law with no funding. Public policy impacts our people. Funding and systems change is needed to achieve social equity in Native health care and aging services. The more we work together, the stronger we become. As sovereign tribal nations, we have special needs and considerations that have to be addressed, especially with regards to Native elders. For example, there are jurisdictional issues surrounding elder abuse, fraud, and exploitation that must be addressed. Tribal, state, and federal agencies must work together for the safety and protection of Indian elders. We need to create and strengthen a web of services for Native elders across the United States. We need better support for caregivers, elders with dementia, individuals with disabilities, veterans, and LGBT elders. Working in Indian country is complex but fulfilling. With over 566 federally recognized tribes, Nakoa is working to fill the leadership gap and provides advocacy when and where we are needed. As a Navajo woman leader working at Nakoa, I am committed and compassionate about working and serving Native elders. You might not think that aging services is your issue, but our teachings tell us in the cycle of life, we will all, if we are lucky, journey through old age. The minute you are born, you are aging. In beauty, may we all travel through old age.